what's up? Hope you are doing well. Abdullah is here. Today I'm going to show you some topographical structures on the posters. So let's start what we have given here. First of all, we have to identify the parts and regions of the anterolateral wall of abdomen. Okay, let's see what is it. So here it's given as topography of the anterior abdominal wall. So these are the structures of the anterior abdominal wall. As you can see here, it's linea alba, which is in the middle. You can see like epigastric vessel, superior and inferior epigastric vessels, rectus abdominis muscle, its rectus sheath, posterior wall. So that's all. Let's go to the next question. Next we have superficial epigastric artery and veins. So let's see this question. So here we have superficial epigastric artery. We have to show here this one. See, superficial, it's like Latin name here, arteria epigastrica superficialis. So here you can see it's like small, it's very small showing here, and beside this is the vein. Okay, superficial epigastric vein. Next we have superficial circumflex iliac artery. Let's see. So here is it. It's written here in the Latin language, arteria circumflexa iliaca superficialis. So here you can see it is the smallest cutaneous branch of the femoral artery. It arises close to the superficial epigastric artery that we discussed previously. See this one, it's very close to the epigastric superficialis. Next we have inguinal triangle or inguinal space. Both are possible. Here you can see this is the general look of inguinal triangle or inguinal space. I will show you another example of this one. Here you can see this is the inguinal triangle or inguinal space, this one also. Okay, so inguinal triangle, it's also called as, it's the second name, Hasselbalch's triangle, which is located in anterior abdominal wall. It's anterior abdominal wall, so here it's located. So let's move to the next question. Next we have inguinal canal. Inguinal canal. Here you can see this one. It's the inguinal canal. Inguinal canal, it's a 3 to 5 centimeter long tube, and it's also located in anterior abdominal wall. In males, what's the function? It conveys spermatic cords, or if we talk about in females, it covers round ligament of the uterus. Let's see your next structure. We have medial inguinal fossa. Okay, so here you can see the medial inguinal fossa, right? So it's the depression located within the inguinal triangle on peritoneal surface of anterior abdominal wall. So it's also in anterior abdominal wall. It's the location. So let's see what we have next. So we have medial inguinal fossa. We have to show it here. This is the medial inguinal fossa, as you can see here also. It's the depression which is located within the inguinal triangle on peritoneal surface of the anterior abdominal wall. So next we have lateral inguinal fossa. Let's go. So in the previous one we saw this one medial inguinal fossa, and this is lateral inguinal fossa, right? So it's a shallow concave stretch of peritoneum. It's located lateral to the lateral umbilical fold on the deep surface of anterior abdominal wall. So you see both are on anterior abdominal wall. So let's move next. We have here arcuate line. Okay, what is arcuate line? Arcuate line is showing here in this poster. So this line is also called as semicircular line. So it's located posterior to rectus abdominis muscle. Like this is rectus abdominis. When you will clear it out, then you can see this line, arcuate line, or you can say it's between umbilicus and pubic symphysis. This is umbilicus and this is pubic symphysis, so it's located between arcuate line. Next we have semilunar line. Semilunar line, so what is it? Semilunar line is located here in this poster. This is semilunar line. Okay, you can see it's vertical or curved structure. It runs along the lateral edges of rectus abdominis muscle. These are rectus abdominis muscles, so it runs laterally, okay, in the anterior abdominal wall. Next we have linea alba abdominis. Okay, so linea alba abdominis on this poster is showing here straight, right? So we can say that it's a band of connective tissue that runs from a person's sternum to their pubic bone. Like it started from here, sternum, to till the pubic bone. Okay. Next we have superior and inferior epigastric arteries and veins on the posterior wall of the rectus abdominis sheath. So it's here. This is superior. This is the superior compartment of epigastric vessels, and here you can see the inferior compartment of epigastric vessels on the posterior side of the rectus abdominis sheath. It's femoral canal we have here. So let's recognize it on the structure which is given to us. So here you can see it's like a small tube. It's like 1 to 2 centimeter long, and it opens superiorly as the femoral ring. Okay, it's like you can see it's a cone shaped structure which is also located in the upper femoral triangle. So let's see lacuna vassorum. Okay, so lacuna vassorum. So what is it? This is showing here. This is lacuna vassorum, like this space. This is a compartment beneath the inguinal ligament. This is inguinal ligament, which allows for passage of the femoral vessels, lymph vessels, and lymph nodes. Here you can see all the vessels that are passing through lacuna vassorum. Next we have obturator canal. Obturator canal, you can see here, you have a look here, see this one like small, this is obturator canal, like here you can also see. So next we have paraumbilical veins. These are the paraumbilical veins. Okay, it is located around the falciform ligament, which is next to the round ligament. You can also show it on the liver. Okay, next we have endoabdominal fascia. Okay, so here you have to found the endoabdominal fascia, which is also known as a parietal or deep investing abdominal fascia. So if we are going to talk about its parietal surfaces, so you can see here the outer red lining is the parietal one, and if you want to go deep, so you can see here the red one inside is also called transversalis fascia, and these both are the branches of the endoabdominal fascia. So next structure, peritoneum. Okay, here you can see and you can find the parietal layer of peritoneum. Here you can see it's in the English, no, it's in the Latin form, peritoneum parietal. Okay, this one is a little bit small, but you can see, you can have a look here. Okay, next we have visceral layer of peritoneum. Mhm. Here you can see peritoneum visceral. This is the visceral peritoneum. Okay, this one also, that is coming viscera. Viscera means internal visceral organs. Next structure you have here the superior compartment of abdominal cavity. Okay, so here you can have a look here. It's the superior wall of abdominal cavity, this one. Okay, so it is divided by which structure? This is called the mesentery of the transverse colon. It divides the abdomen into superior portion and inferior portion. Next we have organs of the superior compartment of abdominal cavity. Here you can see the organs of for the superior compartment of abdominal cavity. For example, we have liver, we have gallbladder, we have spleen, we have stomach, we have duodenum, and next we have inferior compartment of abdominal cavity. So this is the inferior compartment of abdominal cavity. Okay, next we have organs of the inferior compartment of abdominal cavity. So here you can see the organs of the inferior compartment of abdominal cavity. Here, like transverse colon, we have ascending, descending colon, like large intestine and small intestine, you can say. Next we have transverse colon and its mesencolon. So here you can see it's like transverse colon and the mesentery, because this is mesentery that is dividing the abdomen into two like compartments, superior and inferior, and the part of the mesentery that takes part to hold the transverse colon, it's called mesencolon. Okay, so this is transverse colon and mesencolon also you can say. Next we have lesser mentum. Here you can have a look on lesser omentum. This is the lesser omentum. Okay. Next we have common hepatic duct, proper hepatic artery and vena porta. We have three structures. So here you can see this one is a common hepatic duct. Okay. So second structure what we have proper hepatic artery. This one is the proper hepatic artery. Okay, and the last one we have so here you can have a look of vena porta, this one blue one. Okay, next we have omental bursa. So have a look here guys, this is the omental bursa, or you can also say that omental bag. This is the omental bursa. Next we have omental foramen. Okay, so here you can see this is a omental foramen, like a window or hole you can say. Next we have greater omentum. Which is showing here to us, this one. This is the greater omentum. Okay. Next we have a right lateral canal. Here, a right lateral canal. Okay, this one. And next we have left lateral canal. So here you can have a look. This is left lateral canal. Okay. Next, we have phrenicoelic ligament. Phrenicoelic ligament. Here it's written in the Latin form ligamentum phrenicoliale. So here this one, ligamentum phrenicolineale. Okay, phrenicoelic ligament you can say. Okay, next what we have right mesenteric sinus. Okay, as you can see here, the right mesenteric sinus, this one, this is right mesenteric sinus. Okay, next we have left mesenteric sinus. Here you can see it's left mesenteric sinus, this is right mesenteric sinus. Next we have root of the mesentery of the large intestine. You can see here, this is the root of the mesentery of large intestine. This is transverse colon, so it's large intestine. So this is the root of the mesentery. Okay. Next we have coiled trunk. The coiled trunk. Okay. So guys, here you can see this is the coiled trunk. This one. Okay. So next, what we have left here, the left gastric artery. Here you have to find the left gastric artery. Here you can see this is left gastric artery. Next, you have to find the structure splenic artery or lienal artery. Okay, this is the splenic artery which is providing blood to the spleen. Okay, this is the splenic artery. So this is the spleen. So guys, these are the half structures that we already discussed in this video. The rest we'll discuss in the next one. Thank you for your attention. Goodbye.